Kaskaskia College is one of the premier nursing programs in the country. Thanks to a highly qualified and dedicated faculty, Casey is responding to a major shortage of trained nurses and paramedicine graduates for the healthcare industry. As the programs have grown, so has the need for additional classroom and laboratory space and new equipment to meet students' educational needs. The KC Board of Trustees approved issuing $5.3 million in bonds to construct a building dedicated to the nursing and paramedicine programs, which is under construction on the main campus. To help equip the new KC Nursing Education Center, a capital campaign has been initiated to provide the latest in technology, including simulated models for clinical training our graduates will experience as they enter the workforce. We hope you will join us as we diligently work to meet the demands for training nursing and paramedicine graduates today and for tomorrow. Thank you.
Well, we are planning to have several different types of labs. One is going to be for basic skills, where we may have some what we call static simulations, where there's nothing really responding to the student, but they can actually do an assessment, they can do a dressing change or something like that. Then we can gear it up to the next step, where it's a patient room. You can walk in, even to one of them is going to have 4 beds in it. You could walk in where you have 2 patients in a room, 1 patient in a room, or you could have 4 in the room, or you could have multiple students in there doing the same scenario, but with different mannequins, different simulators, and the instructor could then be observing 4 students at the same time. Then we have a couple of them set up that are going to be sort of as an ICU bed, where you could do most anything as far as simulation. You can have the patient changing a lot. In addition, we can record it and or view it outside of the room through an observation room, and then after they are all over, you can sit down and review the video and then discuss, here's what we did. What do you think? Do you see something that could have been improved? Or you did really well on this. It's another learning opportunity for the student to then go back and think about it like, oh yes, I recall this should have been possibly done in this manner. Getting them used to actually responding to situations as they occur with real patients.
They wanted me to be successful. They gave me the tools, they gave me the availability. They were there. I was able to go ask questions when I didn't understand something. They took the one-on-one time to, help me gain that understanding. We had extra time in lab if we needed it. I just feel like they were there to produce nurses.
In the paramedicine room, we have a simulation ambulance. The great thing about that is that it's going to allow these students to learn how to function within the confines of an ambulance, the space. There's a whole different way of being able to practice when you can't get all the way around the bed. You put the ambulance gurney back in the ambulance, and now you have a limited space, but everything is close at hand, and learning how to utilize this and function within the space constraints.
I really think it's going to be great. With hearing about all the different things that they're going to have in there, especially the simulation labs and a more centralized location, and I think I even heard something about they might try to have simulation days with all the different departments working together. So maybe having the paramedicine come in and bring someone to the ER and then have to do basically an emergency room situation. I think that's going to be great. It's that transition from classroom to actual clinical practice that can be kind of difficult sometimes, and so having that opportunity to learn in a classroom setting but also a clinical setting at the same time with the sim labs, I think that'll be a really great benefit, really great opportunity for future students.
Currently, we only have 2 mannequins here that we can utilize in this manner, but we don't actually have a simulation room where sort of making do, and that's why our project is to raise the funds in order to have a true simulation hospital room for the students, so it would be more realistic, and they will be able to go in and have access to all the equipment that would be needed to care for the patients in these various situations.
Anyone who looks at our program here at Kaskaskia College would have a great deal of pride in knowing that their daughters and sons can go to Kaskaskia College and receive a high quality education and graduate with the expertise needed to deliver quality medical and nursing care to our communities. I would like to encourage everyone in our community, including the organizations and private individuals, to think about contributing to our campaign to bring the best technology that money can buy to this institution so that we can continue to provide quality nursing students.